In 2010, the bush along Bombo Road on the outskirts of Kampala, Uganda, was a haven for crime. Today, the bush and the criminals are gone, replaced by a hospital that cares for the poor, who come by the thousands each year. They suffer from malaria, infections, typhoid fever, diarrhea, cankers, and cancers. Doctors, midwives, nurses, and dentists conduct surgeries, deliver babies, give immunizations, and fix teeth. This is Ruth Gaylord Hospital, named after a longtime Twin Cities educator. 3 buildings are open, a 4th is under construction, in an area where people once feared for their safety. The transformation is the dream of an American priest who raised $500,000 for the project, 2 Ugandans who run the day-to-day operations, and dozens of donors. The priest is Father Dease, who was the president of the University of St. Thomas for 22 years. Visiting Uganda to recruit students, he noticed the lack of health care.
It was something for me, like out of a horror movie. The mothers who are giving birth on the floors and rooms and in the corridors. Our motto should be, every mother goes home with a healthy baby, and every baby goes home with a healthy mother.
The Ugandans are Charles Lugemwa and Peter Kagundu, 2 St. Thomas alumni who returned home to make the hospital a reality.
Can a human being be complete with faith and academic education, but with no health care? No. So we said, if we located our clinic at each of the locations where there is a school and a parish, we are guaranteed that their people will access that facility.
Lugemwa opened 2 small medical clinics, found the land for the hospital, and cut through miles of red tape.
Charles is a can-do, make-it-happen kind of person who combines that ability with a profound dedication to the common good. He makes miracles happen.
Today, as hospital board chair, he supervises construction and keeps an eye on operations. Kagundu arrived in July 2014 to serve as chief executive officer and supervise a staff of 40 who care for 1,200 patients a month.
How do you count the value of the lives that they have already saved and will be saving?
Donors include Tom Bazance, a Dallas real estate investment advisor. Dease taught Bazance at St. Thomas Academy 45 years ago, and the 2 stayed in touch. Tom and Susan Bazance joined Dease in May 2016 to dedicate Building A after Tom's late mother. The Helen Bazance Outpatient Center bustled as hundreds of people got free checkups and lunch.
To access a service in a commercial clinic, you must have money. Now, it's not the case in my clinic. It's not the case.
Father Dease was overwhelmed, but not surprised by the turnout.
I was struck right from the start with the gentility of the people here. What I like to call old-fashioned manners seem to be in great abundance here.
Among the 12,183 patients in 2015 was a premature newborn, abandoned outside the hospital gates. A passerby heard a noise, found the infant, and took her into the hospital. Before long, baby Ruth was big enough to move across Bombo Road to live with the Lugemwas, who adopted her. In baby Ruth, Charles says, we see the real fruits of our labor.
I feel satisfied. I feel happy when I see someone benefiting from what I've done.
Contributions to Ruth Gaylord Hospital are fully tax deductible and can be sent to Friends of East Africa Foundation, 2130 Summit Avenue, St. Paul, Minnesota, 55105.